Hi, this is your Chief Science Officer, Brazos Minshew. Welcome to Wellness Talks. Today we're going to be talking to neurologist Dr. Joshua Tobin, who's with the 21st Century Neurology Practice right here in Phoenix, Arizona. And we're going to be talking a lot about fibromyalgia, something that we've all heard of. If we don't have it, we know someone who does. So welcome, Dr. Tobin.
Pleasure to be here. Thank you.
So let's get right down to it. We have a lot of people in our audience who really have issues with fibromyalgia. And, you know, if you don't have it yourself, you know someone who has it. So let's talk a little bit about kind of the structure. How many people have fibromyalgia? How is it diagnosed? How old of a disease is this?
Estimates are that about 3% of the population have fibromyalgia, actually. So it is an epidemic. Let's see, there's 300 million people in the United States. So 1% is 3 million. Wow.
Yeah.
9-10 million people. That's a lot of people.
It's a lot of people. In fact, I think if we were to compare that to something like rheumatoid arthritis, there are only like 5 to 6 million people with rheumatoid arthritis. So twice as many people have fibromyalgia. Yeah. So when did that become such an epidemic? Because, you know, I'm a pretty old guy and I don't remember that disease when I was a kid. So when did we start seeing these cases?
That's a good question. I don't know when it first came into existence. I can tell you when I first started seeing it was when I started practicing medicine right from the get-go. And when I graduated from my residency in 2002, I saw all these people who hurt. And they would get this test, and they would get that test, and this, that, and the other test. And all these tests were normal. And my mentors would throw up their hands and say, I don't know what's causing your pain. You need to go see a pain management doctor and get on chronic opiate maintenance, which we now know actually makes fibromyalgia worse. When did I figure out what all this was? Probably about 2005 or 2006. And I noticed that all these people had difficulty sleeping, and whether they actually slept the whole night through or not, they never woke up feeling refreshed. And about the same point in time, I started practice at, where I'm practicing now at 21st Century Neurology, and we were participating in a trial for fibromyalgia. The mechanism of action of the drug was to improve sleep quality. And so first I learned how to do a tender point examination, which is the diagnostic exam for diagnosing fibromyalgia, and it became very clear that all of these cases, all these people who are suffering, for which we spend huge amounts of money ordering tests that really don't gain us any, that are normal and don't show us anything, they all have fibromyalgia, which it's a devastating disease, but it's also very easy to treat.
Yeah, so the key is fix the sleep.
The key is to fix the sleep.
Yeah. And what's interesting about that for everyone who's familiar with TriVita and what principles we really stand for is that we have the 10 essentials of wellness, 10 things that we know we absolutely must have in order to stay well. And what's essential number 3? Essential number 3 is peaceful sleep. So the better the quality and the sufficient quantity, not too much, not too little, the healthier a person's going to be. And I think fibromyalgia is probably a really good example of what can happen when somebody doesn't get refreshing sleep. And as you mentioned a moment ago, now we're talking in epidemic proportions. Now we're talking about something that grows among the population, 2%, 3%, probably going to top out here at 100% if we keep our sleep habits the way they're going.
If we continue to be a caffeinated society in which many of us pretend that we don't need to get a good night's sleep and you're just supposed to push through it and drink an extra cup of coffee, how many people do you see drinking coffee at Starbucks at 9 o'clock at night and then turning around and getting up at 6 o'clock in the morning and going to work and doing what they do? And they might be able to do this in the short term or maybe even the medium term, but in the long term, this is going to come back and bite them in the proverbial patootie.
Yeah. Can we say that on a podcast? So, I can tell you a little bit of my own experience with some of the things that created really the agony around fibromyalgia and the tender points. And I can say that 100% I agree. We actually had a sleep center at Tiana Health, and we would test people who had fibromyalgia. We would test their sleep architecture. We found the same thing you're finding: fix the sleep, fix the problem. Along the way, there were 3 things that in nutrients that would always help with certain aspects or elements elements of the disorder. One element is the muscle pain. And in fact, let me ask you, fibromyalgia, do they get better after exercise or worse after exercise?
Exercise is a double-edged sword in patients who have fibromyalgia. One of the principles of getting a good night's sleep is to get exercise, because when your body is tired, it is easier to fall asleep. So if you exercise, it is easier for you to fall asleep. The flip side of that is many patients with fibromyalgia, if they exercise, and even if they push themselves just the tiniest bit too far, they're going to hurt more, and pain interferes with sleep. And many of these poor individuals are caught in a vicious cycle of pain, which keeps them up at night, which worsens their sleep, which causes more pain, which perpetuates the whole cycle. So what I tell people is that I don't know how much exercise. I don't tell them not to exercise. I think everybody needs exercise, but they have to listen to their body. And if their body is telling them that they're going to pay for this later, then that's too much.
Yeah, they're likely not to do it then. In fact, that's what Dr. Goldenberg back east, who was the one who actually kind of coined the term fibromyalgia in our era, he said that you could actually fix fibromyalgia. In his mind, you could fix fibromyalgia with exercise, and he had a study where he actually proved that, but it had a 75% dropout rate. Because,
oh dear,
yes, people were hurting so bad after the study. But I can say in my own practice that vitamin B12 will allow the muscles just a little bit more stretch before they tear. And we started that, of course, by just doing trigger point injections with vitamin B12. Later on, we found out that you can get the same effect from sublingual vitamin B12. And you can go a little bit further with the exercise by giving them vitamin B12, just a little bit more stretch before the muscles start to tear. The other two elements were looking mitochondrially at the disorder. There's the energy-producing bodies inside the actual muscle cell are called mitochondria, and usually there'll be a little bit of it's been described as mitochondrial suffocation, that magnesium, especially magnesium malate, but different forms of magnesium will help the respiratory cycle of that mitochondria, or let the muscle not suffocate so much, get the oxygenation to the muscle. And then the third thing is the fog, right? We call that the fibro
brain
fog.
fog.
Yes. How prevalent is that?
It's ubiquitous.
Yeah. It's part of the diagnostic criteria, wouldn't you say?
The diagnostic criteria that I'm familiar with is that fibromyalgia is strictly based on an abnormal tender point examination, which doesn't necessarily require a brain fog. Now, there are different ways of diagnosing fibromyalgia.
Well, let's just ask about your experience.
80% of all patients with fibromyalgia have a brain fog.
Exactly.
And the reason for that is that they're not sleeping well, and when you don't get a good night's sleep, you can't think properly. The way I diagnose fibromyalgia is to do a tender point examination, which is where I press on 18 different specific muscle areas on someone's body, and if the answer to the question, does this hurt, is yes enough times, then it's fibromyalgia.
Yeah, is that still 11 out of 18 times?
It's still 11 out of 18
Still 11
times.
out of 18 times. Very good. Well, as I was starting to say, the fog actually finds some remedy with the omega-3 essential fatty acids. You can start to melt some of that fog. In the case of fibromyalgia, you can start to melt that fog away. And some of that has to do, of course, with when an individual doesn't get the sleep, then there are structural changes in the brain. Would you agree if a person is deprived of sleep long enough?
Absolutely. One very interesting thing that was recently published is that beta amyloid, which is the protein that accumulates in people's brains who have Alzheimer's disease, accumulates in normal people's brains if they are sleep deprived. And the cycle is that when you are awake, your beta amyloid levels increase, and there is something that takes place in sleep that allows beta amyloid levels to decrease.
Right.
And so, of course, the next logical question is, does sleep deprivation, if you sleep deprive yourself enough, are you going to get Alzheimer's disease in 15 to 20 years?
And that's for another show, right? We're going to do another podcast, and we're going to talk specifically about that issue. In this case, what we understand is that there are definite negative downsides to sleep deprivation, and fibromyalgia is one of them, right? So fix the sleep, fix the problem. You may need to see a sleep specialist such as Dr. Tobin about this kind of an issue. Certainly, there are things that we can do for ourselves every day that you heard right here on this program. Reduce the amount of caffeine, increase the amount of activity, especially activity in early morning sunlight really seems to make a difference. Taking things like sublingual vitamin B12, omega prime for the essential fatty acid content, Welavo multi-nutrient complex for the magnesium that we need in order to stop that suffocation. All of those things can help. Put together, they can all lead you to some relief. And remember, fix the sleep, fix the problem. Dr. Tobin, thanks so much for coming and being on the program, and hopefully we'll get to talk to you soon about that beta amyloid in the brain.
A pleasure to be here. Thank you.
Excellent.